involuntary contractions of the muscles surrounding the vagina in anticipation of some type of pain. And definitely when somebody experiences vaginismus, that is one of those dysfunctions, like sexual dysfunction, that you absolutely need a therapist. You need, pelvic floor therapist, and you need a sex med doc if you are, going through this pelvic pain. Diagnosis is based on the presence of more than one of the following. And, we can talk about one of the following symptoms for more than 6 months. So it's deep pelvic pain and tension during penetration or superficial burning, vulvovaginal pain caused by even the slightest touch. There's definitely fear and anxiety before, during, or after penetration, which often leads to decrease in desire. So, of course, anytime you have pelvic pain, you're not going to want it, right? So, unless that's something that you're seeking, and that's, different forms of like kink and things like that, but we're not here to talk about that right now. What we're talking about is just pelvic pain in general. And a lot of times when you experience pain, you're not going to want that. And so that's why that can lead to decreased desire.
And everything in red that you see is actually pelvic floor muscle. So it's not just one muscle, it's actually over 20 different muscles. It extends to your sit bones, it extends to your tailbone. And as you can see, it forms a basket. So it really does provide a lot of support to the organs that sit in it and on top of it. It also is responsible for bladder and bowel control. And in addition to that, it plays a huge role with sex. So arousal and orgasms are also controlled by the pelvic floor muscles, or contributed by the pelvic floor muscles. When I talk about pelvic floor dysfunction, this is a wide or general term, but essentially it refers to any dysfunction that could be going on with the pelvic floor, whether it is the muscles are too tight and or weak. Usually there is a combination of both. I think, commonly we hear, you need to do Kegels, your pelvic floor is not strong, that will solve all your issues. That's, I would say, 95% of the time, not the case. And yes, you can have, purely just a strength issue or weakness, but most of the time there's a tension issue. And when a muscle is tense, it can't function properly. It can't coordinate properly. It doesn't have good endurance. It can't lengthen properly. And this can be a huge cause of pain with sex. So we're going to talk a little bit more about that. But going back to when the muscles are too weak, this usually can be associated with difficulty with arousal or with orgasms.
A yes, no, maybe list. It helps clarify boundaries. One of my clients felt really empowered being like, yes, I say yes to cuddling. I say yes to hand holding. I say yes to this, but I'm going to say maybe later to sex and no to this, right? It gave her some agency, and it gave her power back in her own body autonomy, which allowed for her to know what was a green light, what was a yellow, and what was a red. And with her and her partner being able to understand that about each other, by doing that, they were able to change that list over time. But starting where she was, scheduling non-sexual touch, like back rubs, hair brushing, holding hands. These non-sexual touch can reintroduce physical connection without triggering that fear or that expectation, and keeps that body calm and safe while still having some kind of physical touch. And this creates that connection with your partner.